Okay. Okay. So she's going to be on the treadmill here for 10 minutes. It does look better. How'd you feel this weekend? Good.
Went to the dance.
Did you dance?
Yeah.
Okay. You're supposed to be dancing right now? How'd your brace look with the...
Everyone noticed.
Yeah. She's got a big post-op brace that she dancing in, so.
It was just an accessory, that's all.
So we were struggling to get, we were really struggling with Katie to get 100 degrees of flexion at times. 100. The gait, she was walking real stiff-legged. She was.
Doing better.
What's that?
You're doing better.
Doing better now. We'll be 6 weeks this Friday out of her ACL. And she actually did some rehab prior to her surgery for about 2 weeks.
Yeah.
Just to, she had real bad motion loss, quad weakness. She had probably one of the largest post-injury effusions, hematomas that I'd seen actually, and she has a pretty small leg anyway, so we actually did nothing with her for the first about week and a half other than just let her use the polar care and pretty much iced her knee constantly, and she then we started some therapy. She actually saw a doctor in Toledo at the Medical University of Ohio also, and then after that she resumed with Dr. Heck. This surgery was made, so we rehabbed for a couple weeks, got her motion pretty close to full, and then she was doing really well for the first couple weeks post-operatively, and then started developing a lot of medial femoral condylar pain, some incisional pain as far as where her ACL graft was taken from, or harvested from, and so she started getting a little stiff, and we had utilized the pool quite frequently for the past ACLs that we have treated, and responded very well. And within 4 to 5 visits, Katie's been in the pool already. She's gained actively about 30 degrees of flexion, so it's been awesome. Pain levels decreased dramatically. Gait has improved. Have a seat. We're going to put this around your ankle. Okay. Or you're going to anyways. So buckle it around your ankle. So this is just a 5-pound cuff weight. So we're just going to do a 4-way hip here. Remember these? Start your forward flexion. Just hip flexion forward. Let's have you do forward back. Once you do 25. Okay. So this is the first day that we've added weight to this. Normally we'll just do it without. But she's starting to get a little bit more quad strength here, so. Good squeeze, keep that knee straight. Tighten the quad, tighten the butt, tighten the quad. Is your mom doing any better with her tooth?
Yeah, she has this.
Is Tori getting her cast off there? Let's do a cross in front, out to the side. Good. So bring in, when you're coming forward, come watch me, Kate. Come across in the front. So you're coming a little bit farther forward. Try to activate that medial quad there. There you go. So a little bit more diagonal backwards too. So come across the front. That's it. There you go, there you go. Same number, let's do about 25 of those. I've been having her do a little bit higher rep work in the pool, just to get a little bit more endurance work. She's had some considerable weakness in her VMO, and that's firing well now. However, she's fatigues very quickly, so we've been going about double the normal reps that we will do with other patients. Sorry, you can take that off now.
Okay.
Yes. You ready? Okay, so you're going to want to come down with your right leg first.
My right leg?
Right leg first.
Are you sure?
I'm positive.
Okay.
So right down. You got your walker. Okay, let's do your platform squats. Hang on there. Do a couple sets of 20 today. Now, remember your knee to toe relationship, because you're just sticking the butt out, knees behind your toes. Okay. Knees, keep the knees behind your toes. There you go.
Thank you.
Sure. That looks better, Katie. As much as you can when you're coming through. Yeah, there you go. That's great. March it. You know, that's one thing we teach a lot on land too, is just good job. Now, do you remember the flexion stretch on the step? So let's go 30-second stretches today. 5 of those at least. Just a little self-mobilization flexion. This, as much as anything, I think has helped her a lot. It's a lot less painful. Doing this on land, she was tearful, crying, swearing at me. So usually having her hold this for about 30 seconds. A lot less painful though. Drop your bottom a little bit, Katie, if you can. There you go. Is that stronger? Okay. 5 of those. All right. Stop. Okay, so Katie, just doing a hamstring curl. Try to bend as far as you can. Try to actually remember keep your knees close together. Really tighten that hamstring. These you don't have to hold. Just up and back down. Good. You got all the toe raises. Let's do another 10 squats, just like you did the first time. There are times that we will have 4, sometimes 5 patients in there. We'll usually have both corners occupied, someone on the treadmill, a couple people on the platform. So you can take the weight off. Go ahead and take that off first and drop that down. All right, ma'am, have a seat there. And you can do 5 of the chair flexion stretches, okay? Pulling back with the left leg as far as you can go. You might have to slide forward a little bit, actually, as far as you're getting now. Great. Any pain? No. Yeah, Katie's she's doing a flexion stretch, just seated in the chair. Little active assist motion. She can hold it a little bit farther back, a little bit better of a stretch and reflection, which is the biggest problem that she was having was just her motion and deflection. So. There you go. You're out, man. Hey, thanks. Have a nice day. I'll see you out on the land there.